So the occipital release or cranial cradle. The point of this is to help relieve tension or perceived tightness in suboccipital region up on the top of the cervical spine, relieve tension around C1 and C2. So what we're going to do, there's a couple different ways to do this. I'm going to show you the way I do it. We're going to drag and we're going to come up to rectus capitis and obliquus capitis up in there. The muscles around this area don't need a lot of pressure to be worked. We can do a few things here. Steady, straight up and down pressure. We can wiggle our fingers back and forth just a little bit to mobilize that tissue. And what I like to do after a minute, after that tissue starts to melt, I like to curl my fingers in towards the skull, and I like to go up in that way. So we're going to come up right up under here. Their head should be like a bowling ball in your hand. So if you feel like they're picking their head up, just tell them to relax their head a bit. The more you'll do it, the more you'll find the spot. You don't want to be down on C2, C3. You want to be right where C1 is, slightly above it. Sometimes you can come in and do a cervical traction and then come in. You don't want to be out here. You want to be under. Their head should be in your hands. First, I'm going to go straight up and down. I'm going to feel the tissue, engage that depth barrier, and I'm going to sit and I'm going to wait. There is no time. You don't have to wait 3 to 5 minutes. You don't have to wait 1 to 2 minutes. I would spend some time here though. I'm already able to sink in a little deeper. I'm feeling some heat. So I'm going to move my fingers just slightly back and forth. I'm actually going to move my fingers down towards my shoulders a bit, and I'm pulling back. I'm going to show you what I'm doing here. I'm moving my ring and middle fingers down towards my shoulders. I'm pulling back with my index finger. And this is going to create traction on that tissue and fascia up in there. So that's a neat little technique. Once I start to sink in, boom, I'm going both ways with that. And I can hang out there for a minute, then I can come back to straight up and down. Obviously that was a little quicker for demonstration purposes. I'm still going to sit here until I feel that tissue melt. And again, I'm just going to move with the tissue. Wherever I feel it, take my fingers. Then I'm going to curl my fingers inwards and get a little traction on the cervical spine. I'm going to traction all that fascia and tissue up towards the skull. And again, if you want, you can work inferior and superior, just wiggling your fingers back and forth nice and slow. The muscles are very small back here. It doesn't take much to manipulate them or mobilize them. Once you get where you want to be, just relax. And you can sit here for a few minutes. If your hands start to get tired, you're probably applying too much pressure. It doesn't take a lot of pressure here. Let their head do the work. So if you're wondering how in the world do I get out of this, it's simple. I'm just going to melt out of it. I'm going to start to lighten my pressure little by little. I like this to be slow, kind of like you're floating out of this. It's very nice on the nervous system. And you get lighter and lighter until you can just let your fingers disappear from there. Or you can have some circles. What this is doing is getting more blood flow up in here. This tissue is restrictive or tight around here. You're gonna have lack of blood flow to the brain, lack of lymph flow to the brain. You can get brain fog, headaches, etc. So it's good to work the tissues up around C1, C2, and the suboccipitals here. Also, we can come around the side here, around the mastoid process, where the SCM attaches and it goes up into the epicranial fascia. I like to work right behind the ear there. Come up in here, I hook, and I just go back and forth with my fingers here, very lightly. And then you can start to apply some pressure within your client's comfort zone. And here we're not trying to rip their head off, we're just coming up under here. You can hook right into the suboccipitals and do some traction. I get my hands on the temples, I'm not squeezing, I'm just pulling You don't have to, you're not trying to adjust them. You're just putting some space, decompressing the cervical vertebra. If you want to do stretching here, I like to keep it simple, but here are some stretches. Go into lateral flexion here. You can push down the shoulder, engage the depth barrier this way, sit and hold there for a minute, come out of it slowly. You can slip your hand under the head here, and you can go up to one side and stretch the mid and upper trap out. You can do this to the other side. People with upper back pain, sometimes this will recreate symptoms, so just be careful with that. Ask them. And if you want to just go straight up and down, you can come here, hook on both shoulders, make an X with your arms, and come up and lift that way. But those are some good cervical and head techniques. If you want to learn more anatomy, physiology, and biomechanics, or more massage techniques, drop a like on this video and subscribe to the channel, and check Muscle Matrix Massage out on Instagram. And I'll see you next time.